All right. So for chapter, or not chapter, for unit, the 10th unit that we're covering, this goes over cardiovascular and pulmonary conditions. So let's look at this. So CVDs, cerebral cardiovascular disease. So this is the #1 cause of death in the United States. And again, now I'm going to say probably globally, worldwide. This ends up killing a lot of people. Look, in the United States in 2010, you're looking at about 10 years ago, 600,000 people died from CVDs, right? This is about a quarter of people that died in 2010. It represents 2.4 million people died in 2010. So 600,000 is about 24%. That's a lot, guys. This is the total number of people that died. And again, you have 25%, nearly 25% that died from cardiovascular disease. That's a big concern. It's a big threat. When you look at direct and indirect costs, back then there were, $500 billion. Okay, $500 billion, nearly that much. You can imagine what that cost has skyrocketed to these days. Again, for a half a $500 billion, it required to treat 81 million. This is the size of Turkey. Okay, so think of it this way. This is the population of Turkey, nearly about 81 million people. So if everybody in Turkey had CVD, it would cost Turkey about this much, actually probably much less, but nearly this much, nearly $500 billion it would cost. CVD, coronary heart disease. This is the most common cause for death over here. Okay. So, hey, can you answer this? I don't find out. So the other thing is the percentage of deaths from CVD. So what do we see here? Coronary heart disease. I'm busy. I have a lecture. We have the #1 cause for this coronary heart disease. We have roughly 50% here. Next, we have stroke. Stroke, when you look at it, it's what? It's about 20% over here. Heart failure, if you look, it's nearly 10. High blood pressure, it's a little bit less than that. And then you look at arterial diseases and disorders. So again, a huge part of it ends up being affected. There's a lot going on over here. Okay. What's next? Next, we have, all right, so the cardiovascular system. So what is the cardiovascular system made up of? When you look at this term here, who can answer that? What is the cardiovascular system? Raise your hand if you can answer this question. What is the cardiovascular system? What are the components for it? Nobody knows? Raise your hand. Donna, okay, very good. Let's see. Hold on, Donna. Go ahead, Donna. Tell us.
Hi. Isn't the cardiovascular system related to the heart and the blood around it and the blood vessels in it? Like
very
something.
Good, yeah. Cardiovascular, heart and blood vessels. Excellent. Very good. So this is these are the parts that are going to be affected by it. All right. Very good. Good, Donna. Yes. So part of so you have heart blood vessels. In addition to that, you have a group of very specialized cells that make up the conduction system of the heart. Now, the heart has what's known to be it's autorhythmic. In other words, it has specialized cells that actually produce its own action potential that's independent of other neurons. All right, it doesn't require nerves, neuronal stimulation from the brain or from the spinal cord or from any other. It's not required. The heart, it functions completely independently. In other words, if you think about it, in order for a muscle to contract, you need what? Nervous stimulation, right? This is why you always find muscle and nerves close together. Nerves stimulate the muscles, and this is why you have the NMJs, the neuromuscular junction. However, in heart, we do not have that. The heart does not need nerves for it to contract. The heart has its own conduction system. And the sinoatrial node, SA node, is what creates the action potentials within the heart. So not only is the heart a pump that's pumping blood from chamber to chamber, for it, in other words, it has two sides. Well, let's look at the picture. There's the pulmonary circuit over here, and then there's the systemic circuit over here. The pulmonary circuit essentially receives blood, deoxygenated blood from your entire body, and then it sends it out to the lungs. Now, once it goes out to the lungs, that deoxygenated blood, which is high in carbon dioxide, it ends up removing that carbon dioxide and bringing in oxygen. Once that's achieved, that oxygenated blood ends up coming back, returning by the right and left pulmonary veins to the left atrium. From this chamber, the blood, it passes through these valves here, which are called the bicuspid or the mitral valves. It enters the left ventricle, and from this point, it ends up being pushed out through these aortic semilunar valves. It ends up going into the aorta, and at that point, the very first organ that ends up getting this freshly oxygenated blood is the heart itself. In other words, yes, within the heart, you have blood moving. However, it's not supplying the heart with oxygen and nutrients that it needs to contract. That comes through peripheral circulation. So if you look at the surface of the heart, you'd see blood vessels surrounding it. Now, these is primarily, you guys know, as your right and left coronary arteries, okay? Make sure you pay attention to this. This is very important information, and I wouldn't neglect this information if I were you. I'll just say that much. Read it over and over and over again until you understand. So what do we have here? Right atrium, right ventricle. Remember, as I said, this is the pulmonary circuit, and this is your left atrium, left ventricle. This is the systemic circuit. This pushes blood into oxygenated blood into the systems. This is receiving deoxygenated blood and sending it to the lungs to get exchanged, for the gas exchange to take place. Okay, carbon dioxide going out and oxygen coming in. So what do we have here? Right atrium, right ventricle, left atrium, left ventricle. Between the right atrium and the right ventricle, we have the if you look over here, 1, 2, 3, there's tricuspid valves that you have over here. And if you look over here between the left atrium and the left ventricle, you have the bicuspid valve, or they're also called mitral valve over here, okay? Be sure you're taking notes. Now, over here and here, you look at these two main blood vessels where the blood is being pumped out of the heart, okay? The blood vessels that the heart pumps blood out into, first is the pulmonary trunk, okay? And the other is the aorta. Pulmonary trunk delivers deoxygenated blood to the lungs. The aorta, it's receiving freshly oxygenated blood, okay? It's receiving oxygenated blood. And remember, the first organ to get this oxygenated blood once it leaves the left ventricle is the heart itself by way of the right and left coronary arteries, okay? This wall that divides the right and left ventricle is called the interventricular septum. Interventricular septum. The blood vessels that return deoxygenated blood to this right atrium include the superior vena cava, inferior vena cava. There's also something else that's not shown here, which I'm going to tell you. It's called the coronary sinus. Coronary sinus. That is what it's called. When you go over here, so we have all right, so yes, so, you have valves over here. On this pulmonary trunk and on the aorta, there are valves. And this valve is called the pulmonary semilunar valve, and this is called the aortic semilunar valve. Pulmonary semilunar valve, All right, so be sure you know and understand this very well. It's critical. Now, as I told you before, the heart has its own conduction system. This is it, the sinoatrial node. This is the pacemaker of your heart, SA node. This, it will not randomly, but again, in a rhythmic, in a fashion, in order, it will generate normally between 60 to 100 impulses under normal conditions. Okay, in 1 minute, 60 impulses, between 60 to 100 impulses. Okay, and once these impulses are created, electrical stimulation spreads from again throughout the this right chamber and the left chamber. Right, it goes relatively fast. Now, from here to here, it goes relatively fast, and from here to here, it also goes pretty fast. However, once it hits this thing over here, this is called the atrioventricular node. What ends up happening is this, that electrical current, it slows down. Why is it slowing down? Because again, remember, this is an electrochemical impulse, and they occur very fast. Okay, near instantly, it spreads across here and throughout here. Once they do spread, what happens? The muscles, they contract. When they're contracting, they're pushing blood from here to down here, from here to down here. Now, in other words, that electrical impulse, it travels faster than the blood being emptied from here to here. So, in other words, we need to buy some time. We need to slow it down. We need to slow down that current before it reaches here and causes us to contract. In other words, we don't want these muscles to contract until they're full of blood. So how do we slow that down? We slow it down by this AV node. This AV node essentially just slows it down for a fraction of a second, giving time for these ventricles to fill up with blood. Once they're full up with blood, again, once they start to fill up with blood, then this slowdown, it opens up and then things speed up again. The part where it kind of speeds up again is called the bundle of His. So from here, then it divides into a right and left side. So we call this the right and left bundle branches. Okay, so you have the right and left bundle branches, bundle of His, right and left bundle branches. They then eventually go up and then plug into these what are called the Purkinje fibers, which actually make contact with the muscle cells, which cause the muscle cells to contract, the heart muscle cells to contract. Make sure you understand this, review this. So when you talk about peripheral circulation, look, this is it. This is your right and left coronary arteries. Right and left coronary arteries. These are, here's the left and this is your right coronary arteries. These are the main blood vessels, the first blood vessels that get blood from, when it gets pumped out from this chamber here, your left ventricle. These guys receive it first. Now, then they supply the rest of this heart tissue with oxygen and nutrients that it needs to contract. Okay, if this doesn't get oxygen nutrient first, it can't do its job. Therefore, nobody else will end up receiving blood. If they're not able to squeeze that blood out, brain cannot get it, stomach can't get it, nobody can get it. Therefore, they have to get it first. Their survival is more important, so they can keep everything else alive. All right. Hardening of the arteries, the term is arteriosclerosis. Arteriosclerosis, hardening of the arteries. Okay. And this happens for, can anybody answer me what would be some of the causes for arteriosclerosis? Anybody? What do you think would be the cause for arteriosclerosis? Anybody? Rana? Okay. Rana?
Maybe the high weight, or maybe smoking.
Yes, very good. Smoking, obesity, excellent. Yeah, these are both these could be cause for arteriosclerosis. These are two main things. Yes, plaque formation. Smoking is horrible. You know, that's something you really want to avoid. There's no benefit to this this practice, this habit. Good job. Who is that? Rana, right? Very good, Rana. Okay. All right, so when you look at the pulmonary system, we're talking about the lungs. And when you're looking at lungs, we're talking about an exchange of gases that takes place between the atmosphere and your lungs. Now, the process of ventilation includes taking in air, that's inspiration, and breathing air out, that's expiration. So inspiration and expiration constitute ventilation. Once again, respiration is just the exchange of gases, exchange of oxygen, carbon dioxide. So that's what they call respiration at the cellular level. So ventilation, exchange of gases between your lungs and, again, outside, okay, or atmosphere. Respiration, this is the exchange of gases, gas exchange that takes place at the cellular level between the cells and blood vessels, let's put it that way. The airways end up being divided into what they call the upper and lower conducting pathways. And when you look at the lung as a whole, they end up being compartmentalized into lobes. So let's take a photograph of that. So when you look over here, these are those conducting pathways. So you have this trachea that's over here, and this trachea is composed of these cartilaginous rings that help keep it open. It doesn't, so when you breathe in, it prevents this tube from collapsing on itself. And in addition to that, so again, you have that throughout, again, the trachea, which then divides at this point here, which is called the carina. The carina is where the trachea divides into right and left primary bronchi, okay, right and left primary bronchi. This is the first major division that occurs after the carina. Now, beyond that, what we have are these smaller and smaller and smaller and smaller branches that come off of it. So after the primary bronchi, there's a secondary bronchi. After the secondary, there's a tertiary. After the tertiary, there's going to be a quaternary until you eventually go into bronchioles, terminal bronchioles. Okay, so you go from there to bronchioles to terminal bronchioles. Now, when you look over here, look, this is the left side. Left side, you have 1, 2 lobes. The right side, you have 1, 2, 3 lobes. So left lung is slightly smaller than the right side. Main reason why, if you look over here, this is where the heart kind of comes and sits place. All right, so it's making room for the heart. That's it. Now, insufficiency in the pumping action of the heart, it's going to end up leading to fluid backing up in the lungs. In other words, what they're saying is, if the heart's not, if the left side of the heart is not able to push blood out efficiently, then blood will start getting backed up into the lungs. That's one of it. Okay, and it's a type of heart failure. Okay, so again, that eventually would lead to not only heart failure but also to lung failure. As the lung tissues start to get damaged as well because of overstretching. Now, moving on to cardiovascular diseases, we have ischemic conditions. Now, ischemia means a reduction in flow. So when there's insufficient blood flow to the heart over the course of time, we call that ischemic conditions. Coronary heart disease, again, it's a handful of, this is a term that blankets a lot of different conditions that affect the heart. And one of the things that coronary heart disease does is causes chest pain. We call that, the medical term for chest pain is called angina, okay, angina, specifically angina pectoris. So again, these cardiovascular diseases and disorders, they could lead to the heart muscle actually starting to weak. So then what ends up happening is its pumping ability starts to decrease. Now, one of the things that could affect that would be an embolus. An embolus is another term for a clot within the coronary blood vessels. And if this blocks up blood going towards to the heart, then that could result in a heart attack. Heart attack, the medical term is myocardial infarction. Congestive heart failure, CHF, again, the heart muscles, it's weak. It's not strong enough to pump blood effectively. Again, fluid starts to back up. Again, there's two types. There's right and left ventricular hypertrophy. So if you have right ventricular hypertrophy or right-sided muscle heart failure, then you end up starting to back up blood to your hands, your limbs, your face, perhaps. And then again, if it's left ventricular hypertrophy or left ventricular, left-sided heart failure, then that blood ends up getting backed up into the lungs. Okay, and if you think about it, it makes logical sense. Where the backup is occurring, then the point before that, that's where everything starts to back up. So if you look at some of the risk factors, again, age is one of the risk factors for CVD. Obviously, you tend to see this more in, again, older people, and then also people in their adult lives in the 30s and 40s. If you have a history of CVDs, then you're at a higher risk. If you smoke, you're at a higher risk. Again, lifestyle, if you don't move around, you just sit and do nothing, that's another risk factor for CVD. If you're obese, it's another risk factor. If you have high blood pressure, you have high cholesterol, or again, you're in this pre-diabetic state. All this, you can figure this out just by looking at A1C hemoglobin levels. That'll help determine what your, how your blood glucose has been for the past 3 months. Then you do that with an A1C hemoglobin blood test. A like apple, 1 the number 1, C like cat, A1C hemoglobin. Again, if you have high density, if you have a high level of high density lipoprotein, then that's going to end up decreasing your risk factor for that. Now, there's a lot of lung disorders also. Amongst them is, let's take a break for a little bit and then we'll continue. Okay. All right. We'll come back in like 10 minutes or 10 minutes. All right. Roll call. Listen for your names, please.
Biz aynı eve girelim kanka. Sen niye benden başka eve gittin ben bilmiyorum. Benim aynı eve geldim.
When you hear your name, please be sure to answer.
Bu sokakta bir yere gitmeye çalıştı.
Zena. Zena. Zena, are you here?
Yes, sir. I'm here.
Zena, here?
Yes.
Okay. Yusuf. Ezik. Yusuf Ezik.
Yes, sir. Yusuf Ekiz.
Yusuf is here. Yosir Zaki. Yosir Zaki. Okay. Yomna Sami. Yomna.
Yes, sir.
Yomna's here. Yosir is absent. Yomna Ahmed. Hold on. Which Yomna is here? Yomna Abdul Karim.
Yes, sir.
Okay. How about Yomna Al Amin? Yomna Al Amin, absent. How about Yagine? Mirza Ali Akbar or Akbar? No. Yashar Ozjan. Yasar?
Here.
Gone.
I'm here.
You're here? Okay, come on. Yarub? Yarub Samir? Yarub? Gone. Wala? Taha? Wala is not here. But Tara Muhammad Hussein Al-Jubburi. Tahara is absent also. Tasneem Muhammad, are you here?
I'm here.
All right, very good. Tariq Gundis.
Yes, I'm here.
Very good. Shule Yamak.
I'm here, sir.
Shule is here. How about Sultan Durgut? Sultan Durgut, absent. Suad Abdul Rashid Abdul Qadir. Suad. One. Sime Ozdemir. Sime.
Yes, I am here.
Very good. Simanur Barfin. Simanur Barfin is not here.
Hi. Yes, sir. I'm here.
Come on. Shaima. Rida Abdul Karim Abdul Hadi Hilal. Shaima is absent. Shahada Abdullah Muhammad Sattan.
Yes, teacher, I'm here.
Very good. Shahada Muhammad Mustafa Muhammad Fahmi Al Said. Must be good.
Excuse me,
Shahada.
sir.
Yes.
Suad, I couldn't switch on my mic for a while, sorry.
I passed it. I have no idea if I call your name or not.
Okay, Suad Abdul Rashid, you called my name.
Oh, I marked you absent. Look, I passed 1, 2, 3, 4, 5 students. Now you're coming to me.
Pardon?
5 students I passed. And now you're coming to me.
Yes.
So one of your friends probably told you and you're coming to me. So I messaged the group and I told you earlier. If you're not going to respond when I call your name, don't make up this BS.
No, I had a problem switching on my mic.
Very good. Then maybe
I
you should have used
obstructed.
that mic before. All right, moving
Pardon?
on. Use how to use the mic. Learn how to use the mic so you don't have problems.
I know how to use a mic,
Okay,
but I had
then
a
you don't have
problem
a
switching it
problem.
on.
All
But
right.
I was in class, I'm not absent.
Okay. Shahada Muhammad Mustafa Muhammad. Not here. Safwan. Safwan is absent again. Richmond, not here. Reem.
Yes, sir,
Gati
I'm
Muhammad. Very good. Rawan.
Dr. Rawan, her laptop finished his charge and she cannot enter to listen again.
First, lessons, I told you guys, make sure your equipment is charged and have backup. If you're not going to listen, let me get through this and I'll bring up these 2 points. But very quickly, if you're not going to be prepared, oh, my battery died, my internet is bad, my internet is not working, or my connection is slow, or I didn't hear you, or I couldn't get my microphone to work. Don't give me these excuses. I'm sorry. All they are excuses. Be prepared beforehand so you don't have problems with this. Just because you're present, you're logging in, doesn't mean that you're present in the class. You may be logged into the system, but if your brain is somewhere else, you're doing something else, then you're not really present in the lecture. You're not able to. Anyways. All right. Rana Yagi.
I'm here.
Okay. Ragda Sharir. Ragda Sharir. Usama Hawar. Onur Kaya.
I am here, teacher.
Very good, Onur. Omer Abdulaziz. Omer Abdulaziz.
I'm here.
You're here. Fada Al-Qari.
Yes, I am here. I am here. Yes.
Very good.
Yes.
Nurhayat Sare Atar. Ajar. Nurhayat Sare Ajar. Nurhan Amin Tulba Atia Al-Attar.
Yes, doctor, I'm here.
Yeah, very good. Noor Al-Farmawi. Noor Al-Farmawi. Absent. Noor Abdul Rahim Al-Malla. Noor, okay.
I am here.
Nuran Hamza Wahaba. Nuran.
I'm here, doctor. Yes.
Nuran is here. How about Noor Khalid Abdullah Ghalib?
Sir, I'm here.
Noor Khalid Abdullah Ghalib is
Yes,
here.
I'm here.
Very
Can
good.
you hear me?
I hear you. I got you. Noor Al-Zaim, you're here. Nadia Muhammad.
Yes, I'm here.
Nadia is here?
Sir, I'm here.
Yes. Okay. Nadia is here. Murat. Murat Polat. Absent. Muhjahid.
Yes, sir, I'm here.
Muhja is here. Very, very good.
Yes.
Muhja is here. And then
Yes.
Muhammad Dursun. Javdar. Muhammad Dursun. Absent again.
Mister, do you put names randomly or like letter by letter?
Maybe random, maybe letter by letter. Musab Magdi Al-Sharbini.
Yes, sir.
Musab is here. Muhammad Saddiq Ali. Muhammad Saddiq. Muhammad Al-Awi. Muhammad Al-Awi. Al-Salahi.
Al-Salahi, yes, I'm here.
Very good. And then there's Muhammad Salim. Muhammad Tamir Nafri, Muhammad Kamal Salim. Muhammad Omer.
Yes, sir, I'm here.
Muhammad Omer is here. Muhammad Omer. What about Muhammad Salim? Okay, so Muhammad Al Amir Anas Omer is absent. Muhammad Tamir Nafri Muhammad Kamal Salim is absent. And Muhammad Noor.
I'm here, doctor. I'm here.
Muhammad Noor is here. Very good.
I'm here.
How about Mu'min Fayed? Muhammad.
Yes, sir, I'm here.
Very good.
Yes, sir, I'm here.
Muaz Muhammad.
Yes, doctor. I'm here.
Okay, excellent. Mina Muhammad Fadhir Al Hashimi. Mina Muhammad absent. Marve Shule.
I am here.
Marve Shule is here. Mina is absent. Marve Kayajan.
Here.
Marve Kayajan is here. Men Tahala.
Yes, doctor, I'm here.
Very good. Mentala Dhaya Saddiq.
Yes, doctor, I'm here.
Very good. Minnahallah.
Yes, sir, I'm here.
Very good. Al-Amin Biswas. Absent again. Nathan Al-Said Al-Shahari Al-Said Al-Karadli.
Yes, sir.
Yes. Are you Egyptian?
It's Maysoon actually, but it's written in the
Maysoon.
wrong way. Yeah.
Sorry. Maysoon. Very good. Maysoon. All right.
Maysoon, yes.
Very good. Why is there not a U after the O?
Yep.
Yoke. I know why yoke. Maida Basyoni Muhammad.
Yes, I'm here.
Very good. Maryam Khalid Yahia Aglan. Maryam Khalid.
Yes,
No,
sir.
all right, very good. She's here. Maryam Muhammad.
Yes,
Abdullah.
sir, I'm here. I'm
Very
here.
good. Maryam Abu Al-Qas.
Yes, I'm here.
Very good. Maryam Al-Afifi.
Yeah, doctor, I'm here.
Excellent. Maya Ali Muhammad. Maya. Absent. Mahmoud Dahan. Mahmoud.
Yes.
Very good. Maha Muhammadin Al-Qurani Ibrahim.
I'm here.
Oh, very good. Welcome back. Lamia Osama Gamil.
I'm here.
Very good. Kivanch. Kivanch is not here again. Khadija Khalid Abdul Hamid. Khadija Khalid. Again, she's absent. Marvelous. Marvelous is absent again. Kaltun Muhammad Farha Muhammad. Absent. How about Joanna? Is that right? Al-Shaka?
Yes, I'm here.
Very good. Jamima?
Yes, sir.
Very good. Jamima's here. Ilaida Noor? Ilaida Noor is absent again. Hussein Muhammad Abdul Rasul is here. Hussein Muhammad.
Yes, sir, I'm here.
Harun Abdullahi.
Teacher, you called me. My name is Khadija, but I should allow the app to enter my microphone. So I couldn't open my microphone.
Are your hands broken? Or your fingers broken? You couldn't put
No,
the push button to answer? Okay, moving along. Hamza Ahmad.
Yes, sir, I'm over here. Do not call me out.
Okay. Hamza Ahmad is here. Very good.
Yeah, I'm here.
Aneen.
I'm here. Can you hear me?
Aneen is here. Okay.
Sir, I said I'm here.
Who's I'm here?
Hamza.
Yasin, yes.
Okay.
Harun Abdullah was absent. How about Hamid? Hamid Bakshi, absent. Hajar?
Yes, sir, I'm here.
Hajar Hazam? Okay.
Yes, I'm here.
Very good. How about Hadia Zinhom Muhammad? Hadia is absent. Hadi Khori?
Present, sir.
Very good. Hadir Abdul Rahim. Abdul Alim? Absent. Habiba?
Yes, sir.
Gulsum?
Yes, doctor.
Gulsum?
Habiba.
Habiba is here.
Habiba.
Gulsum. Is Gulsum here? No.
Yes, sir, I'm here.
Oh, Gizem?
Yes, I'm
Gizem is here. Geraldine Zimazile, absent. Genevieve Zolili, absent. Gihad Nasir Muhammad Ibrahim. Gihad, absent. Firat Polat. Firat is absent. Faiza Muhammad, absent. Fatma Zahra Ashraf Muhammad.
Yes, sir.
Very good. How about Fatma Sari?
Yes, sir, I am here.
Very good. Fatma Shakir Mahmood. Fatma Shakir, absent. Ezra Isa.
Yes, I'm here.
Ezra Isa.
Yes, I'm strong.
Yeah. Emir Timur. Emir Timur, absent. Elif Inal. Ihab Magdi Eid. Ihab. Eftalia Khose. Ifsane Jan. Eda Nur Atash.
I am here, teacher.
Very good. Eda Onur. Eda. Ejanur Taktin. Perfect.
I'm here, sir.
Okay. Perfect. Duigu Makul. Duigu? No. Dana is here. I know. I heard Dana. Dana said she was here. Dilber. Chilek. Dilber. Man. And Diana. Were you here, Diana?
I'm here.
Diana here. And Bushra.
I am here, teacher.
Very good. Saddam Muhammad Al-Hajri.
Yes, sir, I'm here.
Bezanur. Bezanur. No Bezanur. Barak Ali.
Yes,
No
sir,
Barak
I'm
Ali.
here.
Oh, Barak is here.
Yes.
Merhaba. Barfin is here.
I'm here.
Barfin Irambal.
Yes, I'm here.
Very
I'm
good.
here, sir.
Bali.
I'm here.
All right, excellent. Baver Bey. Absent again. Basmala. Absent. Basma.
Yes, I'm here.
Okay. Baresh Nuri. Baresh, absent. Bara Isawi. Absent. Bakar Abdul Rahman Dah.
Yes, I am here.
Excellent.
Sure.
Aisha Su Alena.
Sir, can I say something?
No, Aisha Su Alena. Aisha Su, absent. Next one, Aisu Khan. Aisu. Next one, Asim. Asim.
Yes,
Absent.
sir, present, sir, present.
Asim.
Yes, sir.
Yeah,
I'm here.
Hassan Khan.
Yes,
Okay.
yes, I'm here, sir.
Very good. Asim is here. How about Arwa?
Yes,
Arwa?
I'm
Arwa?
here.
All right. Aisu is absent though. Amar Said Hafiz. Amar Said Hafiz. Absent. Asim. Hakan says hi. Ali Wissam Mahmood. Ali Wissam Mahmood. Ali Deb Sawi. Absent. Al Hassan Muhammad El Karnaz.
Yes, sir, I'm here.
You're here, very good.
Sir, can I say something?
No, I'm doing attendance. Al Hamza Layt Salman Al Rubai.
Yes, doctor, I'm here.
Very good. Al Bara.
Yes, sir, I'm here.
Very good. Asan Khan.
Yes, sir, present.
Very good. Asan, are you friends with Hakan?
Yes, sir, I'm friend of Hakan.
Very good. Ahmad Wali Muhammad.
Present, sir, present.
Very good. Adnan. Adnan Al-Shamahli.
I'm here.
Who is here?
Yes, sir, I'm here.
Who are you?
Adnan.
Okay, very good. Abiodun Esther? Absent. Abir? Muhammad Abdullah Saeed? Absent.
Yes. Yes, sir.
Yes, what? Abir is here?
Yes.
Abdul Rahman Saeed Ibrahim?
Is it Abdurrahman Adil?
Ibrahim.
Oh, okay.
Then there's Abdul Rahman Muhammad. Abdul Rahman, yeah, Adil Mubarak Muhammad.
He's in the hospital.
Huh?
He's in the hospital right now.
Oh, he's absent. How about Abdullah Hadi Abdullah?
Yes, Mr. I'm present.
Yeah, very good. Abdullah Ibrahim. There's how many Abdullah Ibrahims are? Okay, yeah.
Yes,
Abdullah
sir, I'm
Ibrahim.
here.
You're here. Okay, very good.
Yes, sir, I'm here.
Thank you. Abdul Aziz Syed, Abdul Aziz Saad Hassan. Abdul Aziz Saad,
Yes.
you're here. Abdul Aziz Hakami. Hakami, absent. Shihata, Abdul Hamid Shihata, absent. Abdullah Hassan Muhammad Ahmad Al Dakhani. All right. Now, let me finish up this recording. Then I'm going to you guys. Good luck. So, moving along with lung diseases, obstructive and restrictive lung disease. When you look at obstructive lung disease, we're talking about an abnormal flow of air that's going into the lungs through the bronchial tubes. Can you guys shut your microphone off? All of you, please. Okay. Restrictive lung disease is when there's a reduced volume of air that goes into the lungs. So in individuals that have restricted lung disease, even obstructive lung disease, they could have what's referred to as tachypenia. Tachy means fast, penia means breathing. So just breathing fast. What are some of the causes of this? Well, among the many different causes for this, it could be pollutants in the air, smoking. It's another one. Infections, and also heart function changes could lead to it. Emphysema is horrible, chronic obstructive pulmonary disease. So in these individuals that suffer from COPD, they end up producing, again, they end up coughing a lot. They have a lot of mucus that's coming out. The sounds of the lungs are different. Also, the amount of breathing also ends up being, they're not able to breathe enough. So they have a shortness of breath. And then when you look at emphysema, this is just air that's stuck inside the alveoli. It results from chronic bronchitis being the most common condition contributing to it. Again, you see this in smokers. Cardiovascular diagnostic tests and procedures that are invasive include cardiac catheterization. So again, there's always a risk to the patient anytime you go any type of invasive procedure. This is where they put a camera inside and they look into the blood vessels in the heart. Aside from that, the non-invasive steps, they could be just taking a chest X-ray. Aside from that, they can do they can check with the heart the level of function of the electrical activity of the heart through an echocardiograph or ECG, and also they can do stress testing. So over here, this is an electrocardiogram, ECG. So what do you see over here when you look at it? You have, again, pay attention to this. 3 things that you should be aware of. 3 waves. This is a P wave. This is a QRS complex. This is a T wave. What this shows is this is showing the atria, the cells within the atria depolarizing. Okay, as the current moves, this is showing the atria depolarizing. So if you, the atria depolarize. So as the sinoatrial node sets off, this is when the sinoatrial node fires. At this point, right over here, SA node fires. When it fires, and as that current moves through, it spreads through the atria. This is what it's showing. Right about this point is when the atria actually contracts. All right. So once the atria contracts, then we have this QRS complex that forms. All right. This is showing the ventricles. So at this point over here, what this is showing is the current moving through the ventricles, QRS complex. Right around this point over here, this is when the ventricle actually contract. Right over here is when the ventricles contract. This is depolarization of the ventricles. This is the ventricle contracting. Then you have over here this T wave. T wave shows the ventricles repolarizing. Okay, so remember, ventricles contracted. Now what are they going to do? They're going to charge up again. So this T wave shows ventricular repolarization. Okay, so you might be asking, where is this repolarization of the atria? You don't see it because of the QRS complex, right? So I think this is what you should know at this point, very simplistically. Now, when you start studying this, you know what the normal values are for each of these. I'm not going to go into it. I expect you to know the basics. I don't expect you to know all these details. The details you will learn hopefully in your physiology class and your anatomy class. Well, your physiology class, not so much anatomy, but I do expect you guys to know just the general basics of this and what it means. So again, what is it showing you? This is showing one cycle of heart activity. In other words, this is one beat of the heart. From this point, this is when the heart contracts, and then when the ventricles relax. The atria start contracting here, ventricles contract, and then the ventricles relax. All right? Simple as that. Very easy. Pulmonary testing, again, you can do CTs, MRIs, you can do a perfusion scan, a VQ. There's also pulmonary angiographies that could be done. You can put video cameras down the bronchioles. That's called a bronchoscopy. Again, you can do what's called a PFT, pulmonary function test. And again, you just breathe into this tube that's connected to a computer. It just tells you how much air is moving. You're able to move with your lungs. It's a PFT, pulmonary function test. And there's also ABGs, blood gas analysis. So an arterial blood gas analysis, that's your ABG, arterial blood gas, ABG. A like apple, B like boy, G like girl. All right. Next one, again, the therapist, the PT will complete this detailed evaluation against your assessing signs, symptoms, syndromes that come from any type of pathologic condition. So you come up with the prognosis, and again, you start estimating the level of improvement that patient may have. Along with that, you make a care plan for them. You write out goals that you want for the patients to achieve, per session basis or per week basis. And along with that, this is where this part comes in. How often should they be coming up to see you? And then what are the criteria for discharge? When are you planning on discharging the patient? What criteria will you use? Along with that, we have this medical management you end up having. What is medical management of by using drugs? Again, you don't prescribe it. Again, physical therapists working with the doctors prescribe it. Physical therapists should be aware of what drugs the patient is using for what condition. Cardiac condition drugs, they're used to alter the rate of the heart. They could alter rhythms of the heart. Also, some of these medications, they can cause the heart muscle to contract even harder. Others, they can improve the flow of blood through the heart and blood vessels. For pulmonary conditions, there's drugs that are used to promote bronchodilation and decrease inflammation. So a lot of these are steroids that they end up giving. They could be inhalers as well. What else? Percutaneous coronary intervention. Again, so they put a tube into the coronary artery and it dilates our artery. The way they dilate that artery is, again, they inflate this balloon. And a lot of times after they inflate that balloon, they end up putting a stent or like a scaffold there. So again, this is where that comes into place, okay? Other times they just end up rerouting the blood. So that's done through a coronary artery bypass graft or CABG. Other times they have to replace a valve. Other times when the SA node is not working properly, the doctor is actually putting an artificial pacemaker. Heart transplants are also an option these days. For pulmonary conditions, you can remove part of a lung, or again, you can have lung transplants. All right, so physical therapy, cardiac rehabilitation. Patients are classified according to the severity of their conditions, and that goes from class 1 through class 4. The therapist establishes inpatient rehab first. So again, usually this happens when the patients are still admitted after the surgery, 1 or 2 days. Physical therapists get involved in their recovery at that point. They end up varying the program based on, they have to be sensitive to intensity and the duration of the exercises. So this phase of recovery, it also influences different parts. So this first phase is acute phase, is the inpatient. Now monitored outpatient care, that's subacute phase 2. Intensive rehab, that's outpatient. It's a lot more independence, that's phase 3. And ongoing long-term rehabilitation, that's phase 4. Again, set target levels, make them realistic. Don't, set levels that are unattainable. Now, I said that in the previous lecture also. So PT, physical therapy, pulmonary rehabilitation procedures, if you look at some of them, you end up for this one, you want to create programs that enhance an individual's aerobic functioning. You have to monitor the vitals throughout the treatment session. Again, also you may end up having to remove access or drain lungs or other fluids. You want to teach them about coughing, also breathing exercises. You want to show them how they can save energy. And again, just try to have them try to reduce the risk factors. So again, I'm not going to go over these, but you can look at the details on this. When you look at some of the strategies what are these strategies to prevent disease? All right, so physical therapists, they can provide information to modifiable risk factors. You want to look at regular exercises also. In addition to that, you want to look at weight control methods, how they're able to control their blood pressure, what they can do for cholesterol management. And again, one of the main things is avoiding smoking. Okay, so that is all for this. And now we will move on to the next part. So who do you want? 1 second. 1 second.